You know that feeling, right? Staring at a really dense textbook chapter, especially when it's on a topic that feels, well, less tangible than, say, anatomy,
Huh.
maybe something like spiritual health in nursing. It can feel a bit overwhelming.
Yeah, like you're supposed to grasp these incredibly personal, sensitive ideas that aren't, easily measured with a tool. It's
Exactly.
a common challenge, definitely.
Yeah.
You're trying to weave these deeply human experiences into a clinical framework that often prioritizes the purely objective, the measurable.
Right. But that's where the real holistic care happens, isn't it?
That's exactly right. And it's precisely why we do the deep dive.
We take that dense information, like Chapter 35, Spiritual Health, from Fundamentals of Nursing the Potter and Perry text, and really try to unearth the most important, actionable insights.
Yeah, think of it as a shortcut, maybe.
Mhm.
A way to get you feeling well-informed and ready for actual practice.
Our mission today is really to distill those key nursing concepts around spiritual health, make them accurate, of course, but also accessible.
And applicable. Directly applicable whether you're in a busy hospital, a community clinic, or maybe even doing home care.
We'll unpack things like patient care principles, critical decision making, safety, ethics, evidence-based practice,
hmm
all through that essential lens of spiritual care. Try to simplify complex terms, guide you through some practical applications.
And connected to NCLEX competencies. Because really, understanding and supporting a patient's inner life isn't just a nice to have.
No, it's fundamental, a fundamental aspect of healing and well-being. So let's jump in.
Okay, so to really get this, we first need a clear definition. What is spirituality in this context?
Right.
The word itself, spirituality, has deep roots. It comes from the Latin spiritus.
Spiritus, like breath or wind.
Exactly. It signifies that vital life force, the very core of a person.
And it's amazing how early this was picked up in nursing. Florence Nightingale, way back.
Yeah. She championed the idea that caring for spiritual needs was just as essential for a healthy hospital environment as, cleaning the floors or changing dressings.
She really set the stage for its importance.
Absolutely. Building on that, the modern understanding sees spirituality as, well, an awareness of your inner self and a connection.
A connection to what, though? It varies.
It does. It could be a connection to a higher power or maybe to nature or just a purpose greater than oneself. It's those personal beliefs that help someone maintain hope and cope when things get tough.
So when we talk about holistic health, it's not just the body.
No, it demands balance.
Yeah.
Physical, psychological, sociological, cultural, developmental, and spiritual factors, they all play a part.
But, despite how important we're saying it is, it often seems like the first thing to get overlooked. Why is that?
Well, the textbook points to a few things. Sometimes it's seen as less scientific.
Hard to measure.
Right, difficult to quantify. And frankly, some nurses just feel uncomfortable bringing it up,
Yeah.
or they feel they lack the time.
Which I guess leads to a really important distinction we need to make clear.
Yes. The difference between spirituality and religion, it causes a lot of confusion.
Okay, so let's break that down. Spirituality is the broader concept, more personal.
Exactly. Spirituality is unique to each individual. It's seen as an inherent human characteristic, whether you follow religion or not. It provides that energy, that drive to cope and maintain health.
And religion.
Religion is defined as an organized, institution-related practice commonly associated with particular beliefs. Think specific doctrines, rituals, communities.
Like the text mentions Buddhism's Four Noble Truths versus Christianity's focus on God's love. Both involve spirituality.
But the expression, the practices are different. They're structured by the religion.
And this applies even to people who don't believe in God, like atheists or those who say we can't know, agnostics.
Yes, even then, people search for meaning and purpose, often through their work or relationships or maybe connecting with nature. It just shows that spirituality, in that core sense of meaning and connection, is pretty universal.
So for us as nurses, understanding that difference is crucial.
Absolutely vital. Because religious care means supporting someone's faithfulness to their specific beliefs and practices.
Whereas spiritual care is broader.
Right. It's helping patients identify meaning and purpose in their lives, look beyond the immediate situation, maintain relationships, even if none of that is tied to an organized religion.
And this connects to something else important, the nurse's own spiritual health.
Yes. How aware you are of your own spirituality really influences your attitude towards providing spiritual care.
So self-awareness is key.
It really is. Being aware of your own beliefs and values helps you recognize and interpret patient cues more effectively. It lets you provide appropriate care, accepting the patient's reality without bias, without imposing your own views. That's foundational for patient-centered care.
Okay, so we've defined it. Now let's talk about the impact, the connection between spirituality and actual healing. It feels intuitive, but what does the evidence say?
Well, it's becoming clear. Research actually shows that spirituality positively affects physical and psychological health, quality of life, even health promotion and disease prevention.
Really, like concrete example.
Yeah, studies show it helps diverse groups cope better with anxiety, stress, depression. Think family caregivers, mothers with babies in the NICU, cancer patients.
Wow. Even nursing students, the text mentions.
Right. It's a powerful coping mechanism.
So those integrative techniques, relaxation, mindfulness, maybe prayer, music, they aren't just like fluffy add-on.
Not at all. They can be really powerful resources. They tap into that inner belief system to support healing. Nursing research even finds that spiritual well-being seems to offer a protective effect against distress at the end of life.
And helps cancer patients stay socially connected.
Exactly. The evidence is building.
It's fascinating how current concepts describe spiritual health itself. It's about finding balance, isn't it?
Yes, balance among your values, goals, beliefs, relationships. It's described as a healthy way of expressing spirituality, something that often grows as we gain more life experience and awareness.
The book describes 5 overlapping constructs, like components of spirituality. Can we walk through those? It's based on figure 35.1 in the text.
Sure, first is self-transcendence. This is about feeling authentically connected to your inner self, kind of going beyond the everyday physical
Like
limits.
that feeling of awe when you see something amazing, a sunset or holding a new baby.
Exactly that. Then there's connectedness. This happens on 3 levels. Interpersonally, within yourself, interpersonally with others, and the environment.
And transpersonally.
That's the connection with God or higher power or however the person conceives it. This connectedness brings comfort, faith, hope, empowerment.
Okay, third is faith and hope.
Right. Faith is having firm beliefs. Sometimes despite lacking physical evidence, it often enables those transpersonal connections. Hope is that energizing, future-focused feeling. It motivates you, helps you strive for goals, even if you're not religious.
Makes sense. Fourth is inner strength and peace.
Yeah, spirituality provides this dynamic, creative inner strength. It helps with tough decisions, being open to change, having confidence, a positive outlook, and inner peace fosters calm, even when things around you are chaotic.
And the last one ties it all together, meaning and purpose in life.
This is crucial. Spirituality helps people find significance, find meaning in both the good and the bad things that happen in life. These 5 constructs self-transcendence, connectedness, faith and hope, inner strength and peace, and meaning purpose. They really paint the picture of a person's spiritual dimension.
And when these are in balance, that leads to spiritual well-being.
Exactly, that feeling of inner contentment, and it's directly linked to quality of life associated with less pain, less stress, less depression.
It's also important to remember this isn't static. The book has table 35.1, which talks about spirituality across the lifespan, linking it to Erickson's stages.
Right. Like how trust in infancy forms a basis for hope, or how adolescents might start questioning beliefs, while older adults often focus on acceptance and legacy. Beliefs evolve,
And culture plays a huge role too, of course.
definitely, which leads us to think about when things go wrong, when spirituality is challenged.
Because spiritual needs often really surface during tough times,
Oh,
right?
yeah.
Illness, loss, big life changes.
Precisely. And that's when spiritual distress can happen. The book defines it as a disruption in the life principle that pervades a person's entire being.
That sounds serious. What does it look like?
It can manifest as questioning your identity, doubting your beliefs, losing faith, feeling totally alone or abandoned by God or others, or maybe conflicts between your beliefs and what your health treatments require.
With the example of not being able to attend church services during the pandemic.
Exactly. Illness itself has a huge impact. An acute illness, something sudden like a heart attack or
It
accident.
can trigger anger.
Yes, anger at God, family, even oneself. How strong someone's spirituality is really influences their coping.
And chronic illness. That brings different challenges.
Often powerlessness, a threat to independence. Here, spirituality becomes a really key resource for adapting. And successful adaptation can actually lead to spiritual growth. Nurses can help by exploring the meaning of the pain and suffering with the patient.
Then there's terminal illness. The fears are immense pain, loss of control, the unknown.
Some patients find incredible spiritual peace. Others really struggle, questioning everything, why me? Our role is to support them and their families through that.
The text also discusses something fascinating, near-death experiences, or NDEs.
Yes, this psychological phenomenon reported by people close to clinical death. They often describe feeling intense peace, maybe floating out of their bodies, seeing tunnels or bright lights.
Sometimes meeting loved ones who've passed.
Right. It's reported across cultures. And while there are scientific theories about brain chemistry changes,
Like reactions similar to certain drugs.
possibly, but the key thing for nurses is that patients might be reluctant to talk about it.
So our response is critical.
Absolutely. Being open, accepting, non-judgmental allows the patient to share and process what can be a profoundly transformative experience. It often reduces their fear of death.
This ties into that case scenario in the book Jeff, the student nurse, caring for Lisa, who has breast cancer.
Right. Jeff realizes that Lisa's hope is tied to her spirituality and will help her cope. He sees the connection between her potential feelings of loss and grieving and the need to let her share her feelings about the future, about her diagnosis.
Which brings us nicely to the nursing process itself. How do we apply all this in practice, starting with critical thinking?
Critical thinking is central, as shown in Figure 35.2. It's about integrating everything, knowledge, experience, the environment, patient info, your attitudes, professional standards to anticipate issues and make good clinical judgments about spiritual care.
And it starts with the nurse's own self-awareness again.
Yes. If you're comfortable with your own spirituality, you're more likely to address your patient's needs effectively. But crucially, be aware of personal biases. Don't impose your beliefs. Taking care of your own spiritual well-being makes you a better resource.
And we rely on core principles like therapeutic communication, caring.
Respecting patient preferences. These align with QSEN competencies. Plus, standards from the Joint Commission and the ANA Code of Ethics mandate, acknowledging spiritual needs and providing compassionate, respectful care.
Okay, so let's talk assessment. Recognizing those cues for spiritual needs.
It's not a one-off checklist. It's an ongoing process, built on caring and trust. You need to see things through the patient's eyes.
So using open-ended questions.
Definitely. How is this illness affecting what's important to you spiritually? Or are there religious practices you want to continue? Or who gives you strength? Simple, open questions.
And the setting matters. Quiet, private.
Essential for these intimate conversations. You also need to understand their physical and psychological response to illness to know how best to support them spiritually.
The book mentions assessment tools. Listening to the patient's story is key.
Absolutely. And then there are more structured tools.
Right.
FICA.
Right, FICA. F is for faith or belief.
I is for importance and influence.
C is for community.
And A is for address. How should we address these needs in our care plan?
And Jeff used FICA with Lisa.
He did. It helped him understand her strong faith, how important it was, and her church community support. It grounded his assessment, preventing assumptions.
Box 35.1 outlines key areas to assess, like faith belief, asking about potential conflicts with treatment.
Yes, like Jehovah's Witnesses and blood products, or Christian Scientists potentially refusing medical interventions. You have to ask.
Also, life and self-responsibility, how they cope with change, make decisions, connectedness to self, others, nature, a higher power. Asking about prayer is important here.
Right, and life satisfaction. Culture, too, box 35.2 highlights asking things like, how do you find strength? Or using interpreters.
Don't forget fellowship and community, identifying their support networks. And ritual and practice, how illness affects their ability to follow specific religious practices.
And vocation, how illness changes their sense of purpose in work or daily life.
Jeff's assessment of Lisa was comprehensive. He asked her and Joe questions like, what gives your lives meaning? And how do the changes from the cancer affect what you need to do?
And his understanding of potential spiritual values in African-American women helped guide his sensitive approach.
Okay, after gathering all that data, we move to analysis and nursing diagnosis.
This is where you interpret the findings. Common diagnoses might include spiritual distress, if someone lacks hope or feels angry at God, or maybe hopelessness or powerlessness.
But for Lisa, Jeff identified decreased spiritual distress.
Right, because her strong faith and community support were resources already helping her cope, even though she also had anxiety and family process issues. That was his clinical judgment about the priority.
Next step, planning and outcomes identification, using judgment and evidence to create a plan.
The text shows a concept map, figure 35.5, linking Lisa's diagnoses and interventions. The key is partnering with the patient and family. Set realistic outcomes based on their beliefs and culture.
Like Patient expresses feeling peaceful, or patient reports feeling connected to family.
Exactly. And spiritual priorities aren't secondary. In acute distress, spiritual support might be about control. In terminal illness, it's often the most important thing.
Teamwork is crucial here too, right? Involving clergy, pastoral care.
Absolutely. Faith community nurses, especially for older adults, hospital pastoral care departments are invaluable resources.
Jeff's plan for Lisa involves setting goals with her, like daily prayer meditation, talking with Joe, and he planned to connect with the faith community nurse and involve her family. Very collaborative.
Okay, assessment, analysis, planning. Now implementation, putting the plan into action.
This is where we actively promote well-being, help with coping, reduce stress.
A cornerstone is establishing presence. Benner's concept, being with, not just doing for.
So active listening, offering closeness, just giving your time.
Exactly. It builds trust, provides hope. You're also supporting a healing relationship. Look holistically. Mobilize realistic hope, maybe teaching self-management skills, help them find meaning in their illness, help them use their resources, social, emotional, and spiritual.
Jeff did this with Lisa, asking about her communities, getting permission to involve the faith nurse, praying with them when teaching relaxation.
Right. Even in busy acute care, a soothing presence, supportive touch can make a difference. Support systems are vital. Encourage family visits, involve them in care, collaborate with spiritual advisors.
We also need to consider practical things like diet therapies. Table 35.2 shows how food is tied to faith. Halal, kosher.
So consult a dietitian, involve the family to ensure respect for the practices.
And supporting rituals. Facilitate prayer, readings, sacraments, respect icons. Box 35.5 specifically mentions supporting older adults' prayer, meditation, and legacy work.
Prayer itself is a huge coping resource. Respect privacy, offer to participate if asked, or just provide quiet time.
And meditation. The text describes it as a way to elicit the relaxation response, reducing stress, increasing awareness, helping with pain, anxiety.
Yes, box 35.6 actually gives patient teaching steps for meditation, finding a quiet space, setting an intention, focusing on breath. Simple, practical techniques nurses can teach.
Finally, implementation includes supporting grief work, especially with terminal illness or loss of function. Providing that caring therapeutic relationship is key.
Which brings us to the final step, evaluation. Did our spiritual care make a difference?
And again, it's through the patient's eyes, as figure 35.6 shows. We need their feedback.
Critical thinking again. Did we meet the goals we set? Ask them directly. Were your spiritual needs met? Did you feel comfortable talking about them?
Outcomes are often subjective, right? You're looking for signs.
Like increased connectedness with family, maybe a renewed sense of purpose, perhaps more confidence in their faith or higher power, if that's relevant to them.
And if outcomes aren't met,
You reassess. Ask more questions. Do you feel a need to forgive someone or be forgiven? Which spiritual activities helped, if any? Would talking to a spiritual advisor be helpful now? What would help you feel more at peace?
and with Lisa, the evaluation was positive.
Very. She reported praying daily, talking with Joe, involving her family, even planning for the future. Her feedback to Jeff was powerful.
The best thing you've done is listen and recognize how important my family is to me. Your suggestions have helped. I am truly blessed.
It really shows the impact when spiritual care is truly personalized and integrated.
So we've covered a lot. From defining spirituality in nursing, understanding its impact, navigating distress, and walking through the entire nursing process, assessment, diagnosis, planning, implementation, and evaluation.
The core message is seeing the whole person, providing care that really nourishes every dimension of their being.
So the final thought for you listening is this. In what unique ways will you integrate spiritual care into your practice? How will you bring that healing, hope, and peace to your patients, really embodying both the art and the science of nursing?
Thank you so much for joining us on this deep dive. We're really glad to have you as part of our learning community. Until next time, keep exploring, keep learning.
And keep making a difference.